Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic is bitters and obesity. When we talk about obesity, obesity has so many underlying conditions. You have what we now call metabolic syndrome, a situation of where there is hypertension, diabetes, and you have high triglyceride and others. So these are problems, conditions that really will not give one a very good life to really experience life in its fullest. What really causes obesity? We may want to know. It is more of a genetic problems and environmental. When we talk about genetic problems, you want to think that these are problems that you cannot avoid. But majority of these problems are epigenetics. That is, it has to do with the environment. And when you talk about the environment, you are talking of what the person gets from the environment that is now affecting the system. Majority of these things that we have in our body are proteins that are produced by from the genetic makeup of a person. So you have certain controls. There are certain controls in the human body that prevents us from being obese. These are basically, we can just put it that something produced from the stomach. The stomach produces certain things, hormones that really makes us hungry, creates appetites, and then when the appetite is satisfied, the adipocytes, the fat cells, they produce hormones that really create that satisfaction. But when there is a disturbance, a mutation, a problem with the genetic makeup of a person, this balance is destroyed. The energy input and output, that is what is used for, becomes a serious problem that is now accumulating as fats. But what is common between fatty people is that they eat more of additive substances. So the idea of let's see whether if they take more bitters could help. So that brings about this topic, the bitters and obesity. What is the effect of bitters on obesity? These are findings that are seriously supportive of taking bitters. But there are some research results that even creates fear that some bitters can cause cancer. Another question that you may want to ask is, what is the laboratory role in all this? Yes, the laboratory has a major role to play in the measurement of these hormones, these substances that could be affected by the bitters. Is the bitter going to help these hormones to create that satisfaction that would stop overeating, that crave for more food, or is it going to cause other disturbances of the homeostasis? Just let's move on to the slide section to know more. The outline: objective, introduction, research finding, laboratory diagnosis, and recommendations are what I shall be dwelling on. The objective: to show the effectiveness of some bitter substances in the prevention and management of obesity and its complications, with some encouraging values of some laboratory parameters. Introduction: obesity is an excess energy distribution by adipose tissues. What I mean by that is when you have too much energy, more than what the body needs at the particular time, it's now disposed to be stored as fats. There are so many hormones involved in energy equilibrium. Prominent among them is ghrelin for appetite, hunger in the stomach, and leptin, that is in the small intestine, the satiety hormones in adipocyte of fat cells. When you look at this picture of this young man, everything is almost perfect. There is nothing to say it's out of formation, and that is usually when the things are in equilibrium. When there is disequilibrium, there is overweight or obesity caused by overeating or poor energy expenditure. White adipose tissue stores excess energy, just the white adipose tissue has shown, as a lipid and regulate lipid mobilization and distribution in the body. So the fat tissues or fat cells play prominent role. It does this by recruiting more adipocytes to accumulate more fats and undergo cellular hypertrophy. Brown and beige adipose tissues, on the other hand, burn lipid by dissipating energy in the form of heat during a calorie shortfall. Obesity is described as excessive fat accumulation, as seen in this picture. You can see how fat has disposed itself to all the corners of the body. Factors that modulate the association between dietary intake and obesity include physical activities. That is, if such a person has been involved in physical exercises, genetic and epigenetic, you are now talking of some mutations, what we eat and the surrounding, what the environment produce. Those things affects the genetic. It causes they cause mutation of these genes. Chemicals or pollutant exposure could also affect, it could cause the mutation. Poor sleep pattern, not enough rest for the body to return to a very good microbiota. We are talking of the stomach gut, which is the area of interest where the bitters substance is really effective. Energy dense diet, too heavy, over nutrition, and adipose tissue dysfunctions. This happens when you have a problem of over indulgence. These factors disrupt either energy intake, expenditure, storage, or all, as found by a researcher. Bitter substances, on the other hand, are bitter to the taste and sometimes assumed to be toxic. So generally, the body now produces something. It's not addictive in any case. They are used as herbs in many developing countries. For clarity's sake, I shall take some known bitter substances that we consume and expose their preventive and management of diabetes so that our knowledge may be full. Let us look at the work on bitter leaf. The leaf is very distinctive, as seen here, and it's also botanically called Venon amegalina. It's a shrub that grows up to 3 meters high in Africa tropics. Its organic extract was shown to possess a cytotoxic effect on cancer cells of the nasopharynx. It's also effective against amoebic dysentery. It has antimicrobial and antiparasitic activity. It is rich in antioxidants. It has effect on the GI tract when you're talking of the gut, the anti-helminths, and we are talking also about diabetes as regards the obesity. Yes, the most important effect that concerns us right now, it's the glycemic response. It slows down the release of glucose into bloodstream, contributing to a lower glycemic response, good for the management of obesity. The combined effect of reduced blood glucose and enzyme inhibition suggests that bitter leaf can be a beneficial dietary intervention for managing type 2 diabetes and obesity. Let's talk about bitter kola, Garcinia kola. The medicinal plants play a prominent role in the treatment of many diseases among human beings. According to WHO, 80% of the population of low-income countries engage in the use of plants for primary health care. You can understand the cost implication. It is cheaper, not as exorbitant as the Western drugs. Garcinia kola is a tree that grows in the tropical forest. Its seeds are highly valued for their many medicinal properties. The plant's extracts are used in the treatment of laryngitis, cough, and liver disease. The phytochemical study of the Garcinia kola seed highlighted in this diagram the presence of flavonoids, alkaloids, steroids, phenol, and tannic acid. and there is a work done by some Nigerian as well. They found out that extract of Garcinia cola seed have a hypoglycemic effect in normal glycemic and diabetic alloxan-induced rats. Yeah, the conclusion of that study shows the daily consumption of one seed of the bitter cola during 3 months without any break decrease creatinine rate and activity of serum aminotransferase and do not have a significant effect on glycemia. That's where we are interested in. Therefore, the Garcinia cola seed may be used in therapies due to its protective effect on the liver and kidney. If it has a lowering effect on glycemia, then it should be recommended for the management of obesity. That is the conclusion if it has shown that, but it didn't show that in this Nigerian study. Now let's look at other bitter substances. The preclinical trials of other bitter substances is shown below. In studies on both cell lines and experimental animals, bitter agonists have been shown to potently stimulate cholecystokinin, that is C6K, which regulates digestion and satiety. The glucagon-linked peptide and ghrelin. Ghrelin creates that appetite, but the C6K has greater effect because it also regulates digestion, and it's more like creating that leptin effect of showing the satisfaction. When there is satisfaction, it stops the ghrelin effect of appetites, craving for more food. Furthermore, bitter tastes modulate contractility in mouse gastric muscle strips and slow gastric emptying. These findings in preclinical studies have triggered considerable interest in the investigation of the effect of beta agonists in clinical studies to determine whether their effect can be reproduced in humans. While some clinical studies have reported the effect of beta substances to stimulate GLP, CCK, suppress ghrelin, like I said, modulate gastric motility, and or suppress energy intake, the observed effects are inconsistent and often modest. Moreover, only 2 studies have to date reported effect to lower postprandial blood glucose in humans. Yes, let's look at the human study. In a study done in New Zealand, there was observed a contrast. In healthy males and females, 80 milligram quinine hydrochloride, that's a bitter substance, ingested orally in an acid-resistant capsule did not increase absolute plasma CCK. That is contrary to what is found. Although the change in plasma CCK relative to baseline was slightly greater after consumption of an ad libitum standardizing buffet meal. Moreover, 60 minutes intraduodenal infusion of this bitter substance providing 75 milligrams 37 and had no effect on plasma CCK in healthy lean men. In these later studies, the relatively low infusion rate may have been insufficient to reach a critical threshold for activation of the TAS, which is primarily responsible for detecting bitter taste. Once the bitter taste is detected, probably it's speaking of this. Yeah, the laboratory diagnosis. The lab is very useful for personally monitoring the preventive and management of these various substances in blood tests by doing a postprandial. What we mean by postprandial is after you have eaten and you have probably taken these substances, then you do certain things that affects the digestion and satiety, like CCK, GLP-1, leptin, ghrelin, and even glycolated hemoglobin. Values the HDL, triglyceride, and fasting glucose would be a useful test to give confidence to you as the user. The recommendation. Apart from the recommendation made with using the laboratory diagnosis to assist in knowing the bitter substance that will be good for you. There is a need to understand that the prevalence of obesity and overweight have skyrocketed in recent years, reaching epidemic proportion with the incidence rates more than doubling since 1980. As of 2016, about 44% of adults, more than 2 billion worldwide, were overweight or obese, with over 70% of them living in low or middle income nations. Overweight and obesity affects about 30% and 10% of adults in sub-Saharan Africa, respectively. In Nigeria, approximately 21 million and 12 million people aged 15 and above are overweight or obese in 2020. With all this in mind, and the plethora of problems associated with obesity, the additional recommendation take cognizance of bariatric surgery, or what you may call partial gastrectomy, induces weight loss. Then bitters should be able to perform likewise, but not the alcoholic preserved bitter drinks that are all over the place, as alcohol is implicated in 7 cancers. That you must understand. What I'm trying to impress on us is that the alcohol are used to preserve some of these leaves, because it will not last long. They spoil easily. And so putting alcohol to preserve and sell in bottles is the option of majority of these bitter drinks that are available in the public. But the alcohol in itself is implicated in 7 cancers, and so there is that concern too, that you now overindulge in that, and you are living from fry pan to fire. So the recommendation take cognizance of that as well. So if you like my presentation, watch more videos, and subscribe, and more will come your way.